concussion, we'll retest them to see when does their performance recover to baseline. Because this is actually a very sensitive test. And just to pick out a couple of examples, this is a module looking at the memory, and the group in blue is the non-concussed control. So you can see here over 2, 5, 8 days, their performance on this memory test is pretty consistent. The red line are the athletes that have had a concussion, and you can see when we study them 2 days later, their performance drops quite significantly. And we've seen this time and time again, even for very mild injuries. It's a very sensitive tool, and then we can watch over the next few days as their performance comes back up to baseline. Same thing is true for reaction time. Here, slower is bad, okay? So in this group, the controls have a pretty consistent reaction time. The concussed athletes' reaction time slows down, and then it recovers back to normal as they're getting better. So this gives us one objective way to evaluate the brain's performance over time after this athletic concussion. It's currently being used by all the National Football League, all the National Hockey League, 31 Major League Baseball teams, all the national baseball umpires use the test. Only 7 of the NBA teams, MLS, Formula 1 racing, and I think the Olympic teams I'm familiar with are soccer, hockey, skiing, and boxing that are using this, and over 100 major U.S. universities that are using. So, as I said, there's several commercial products. This is kind of the industry leader. But the point is, it's become widely adopted by these leagues as part of their management of their athletes with brain injury. Other assessment tools now, some of which you'll, I think, hear about today that are in development, issues about balance. We can measure athletes' balance and vestibular function because, again, that's affected by concussion. And there are ways to assess this. There are devices being developed that can assess the athletes in these domains as well to tell us whether they're recovered or not. So once we've diagnosed a concussion, we know where they are, and we think an athlete's recovered, how do we get them back to play? Well, we go through a very stepwise return. So first of all, first point's most important, no activity until they're asymptomatic. That means nothing. No running, no jogging, no lifting weights. In your sports, no trotting, no walking. I mean, we don't want them doing anything physically exertional. Even mentally exertional activities can prolong the concussion. So we tell them, don't play video games. Don't sit there and text message 500 times a day. I mean, we really want the brain to kind of be turned off and to recover. That's the quickest way to get better. Once they do that and they're asymptomatic, then we'll let them start doing some light aerobic exercise. Then we move them back into their sport-specific drills, and if they are a contact athlete, like football or hockey or something like that, we'll put them in non-contact drills first, full contact, and then game action. Now, this whole progression, I did not put a time on. Sometimes people say, well, it should take a week or it should take 10 days. I think, again, that's very athlete and age-specific. But what's important to know is that you shouldn't go from this step to this step. And again, that's something that's been done in the past. So-and-so set out, and it's pretty good. Okay, let's put him back in the game. That's clearly an inappropriate way to assess whether someone's fully recovered from their brain injury. And so we need to adapt this for whatever sport we're involved with to go through a progression. Yes, ma'am?
I have a quick question.
Sure.
When you showed the impact studies, it looked like 8 days is when
right.
At least the case study
Right.
came back to normal. Do you see a difference if it's a first-time concussion or if it's a subsequent?
So the question is, does the time course of recovery vary with the athlete's previous concussion history? Great question. The answer is absolutely it does. So several factors. Age that I mentioned. The younger athletes take longer to recover. Female athletes take longer to recover. And if you've had previous concussions, the more you've had, the longer it tends to take to recover from each event. Also, if you've had previous concussions, the less of an impact it takes to reproduce greater symptoms. So there's kind of that phenomenon of glass jaw in the boxers, you know, where it's like they barely get hit. My favorite example is Steve Young, who played quarterback for the 49ers. I mean, he got to where he had a concussion every time the wind blew hard. You know, I mean, he didn't hardly have to get hit. He was literally having a concussion every Sunday, and that's when he decided to retire. So clearly your threshold lowers and your symptoms do last longer the more concussions you have. Yes, ma'am?
Could you clarify younger athletes with age?
As I get older, younger becomes older and older. The break points that have been shown in the data tend to be high school versus college versus professional. So clearly that's a broad generalization, but we think that, or we make a distinction in our practice between high school age and college age. And then there's another break for professional. Now that's mostly football driven, because that's where the most data is. But I think you're seeing this in other sports. For example, in ice hockey, they've taken that and they've used it to restrict the amount of contact that is allowed at the younger ages. So for example, ice hockey in certain leagues under age 14, they can't be checked at all. There's no checking, body checking into the boards and things like that.
So then it would be accurate that, say, a 21-year-old versus a 40-year-old, is the 21-year-old more likely to recover sooner than a 40-year-old?
Question is a 21-year-old more likely to recover sooner than a 40-year-old? Probably yes. Again, though, concussion history plays a role into that. So if that 21-year-old's had 4 or 5 concussions by age 21, they may have a very different recovery than a 40-year-old with a first concussion.
Is it 12 years old where you see a major change in the way the concussion is shown?
Is 12 years old the age where we see a major, you mean clinically or?
How the symptoms, the way that young children under 12 seem to exhibit concussion symptoms quite differently to ones.
I think the answer is probably, but we just don't see as large a number of those because they're not participating as much in the sports that we see the concussions. I mean, we tend to see more severe head injuries in those younger kids because they're kids being hit by a car on their bicycle and things like that. Under 12 years of age, for example, in football or hockey, they can't generate the speed for the collisions that they can as they get older. So we don't see as many significant concussions there. But I think anyone younger, in my mind, purely arbitrary, no data. 12 and under, 12 to 18, 18 to 24 or so, and 24 and above. Those are kind of the groups that I use. Very arbitrary.
I don't mean to jump in, but physiologically, a 12-year-old girl and a 12-year-old boy can be totally different.
Yeah, good point.
So the 12-year-old girl might be like an adult, a 12-year-old boy may not even have each one yet.
Fair enough. Good points. So about the time course of recovery, getting back to your course, this is some data out of high school athletes. And again, you see the most common symptoms. Only about 6% of this group lost consciousness. Average duration of symptoms about 3.5 days, and full recovery at a week in 88%. So many trainers and athletic professionals carry in their mind a week as a time course of recovery. But I will say to you that, again, this has changed. For example, in college football that I take care of, we may have an athlete who's knocked out on the field, who's unconscious during a game on a Saturday, who we test and we do the cognitive testing and we see them through their progression, and they may be cleared and be back playing 1 week later after having been unconscious the week before, because that's not as severe a concussion. We know now that loss of consciousness doesn't mean severity of concussion. On the other hand, we may have an athlete that just runs off the field and seems fine, and they may miss 6 weeks because of their progression through those tests and so forth. So while 1 week is a benchmark, it's not an absolute, and we see examples on both sides of that. I'm going to say just a slide to end up about research trends, and I didn't list a lot because there's so much we could say here. The bottom line is our treatment for concussion has been poor, okay? Sort of like this very uniform treatment for a variety of equine conditions. Up until now, our treatment for concussion has been don't play. That's been about all we've had. And we're still there in terms of data, but a very active area of research, a lot of discussion about different drugs and treatments that may be of benefit, a lot of discussion about how to understand the cumulative effects of concussion. Again, I've got a whole hour-long talk I could go into this area I'm very passionate about, and I think you'll be seeing a lot more. But the bottom line is it's a very fertile ground for research. But right now, we still don't have that magic bullet, that pill, that treatment that we can give someone to shorten the concussion, and we only shoot the ones that we don't like. So that's kind of an overview from the standpoint of pathophysiology and what we're seeing. I appreciate your attention. I'm glad to field any other questions. Yes, ma'am.
As far as the cognitive testing, do you see with any athletes doing a baseline test actually potentially not trying to...
So do they take the baseline? Great question.
Well,
And
that's something that I'm an event rider, and we're going to have return to play rules, and
Yes.
we're encouraged to take a baseline test. But do any athletes, can you actually take the... I haven't done it yet, so...
yes. Yes, you can fake it and I can help you. No. So with the the test first came out, it wasn't an issue. It was brand new. Then, of course, like everything, people figure out how to game the system. So the idea is if you don't try as hard and you make a lower baseline, then when you get concussed, you don't have to come back up as far and you can be cleared quicker. The test makers have caught on to that, and so there are internal controls now that basically allow you to identify when someone's giving a submaximal effort, and you can make it as an invalid baseline. So, but it is a problem because, for example, we're incredibly blessed in the Nashville area that every high school, public and private, gets baseline testing of their athletes. Everyone, almost unheard of to have that degree of penetration, something I'm very, very proud of. Unfortunately, for a lot of those schools, the way they do the baseline is they send the athletes home and they say, log onto this website and take the test. Well, they're at home taking the test. Oh, yeah, what, Mama? You know, music's playing, stuff's going on. And so it's a completely invalid baseline because it's really not their best effort. So we've had to do some education of the trainers and say, we're thrilled that you're getting baselines, but we kind of got to control how to do that or it won't be a valid point. So there are controls and standards built within the tests, and we can sort of detect when an athlete's trying to tank on their baseline. However, I would say, too, the other answer to that question is that cognitive testing is not the be-all and end-all of the assessment. I mean, it is clearly an advance, but it's one component of the overall assessment about the brain injury. And so there are other ways, there are other tests, there are other means that we need to be assessing the athlete, and not just using that as kind of the holy grail. It's very important, it's very useful, it's very objective. But for example, balance testing, there are now ways that you can measure postural stability and sway on a machine, portable machine. You know, again, pretty hard to fake that. And so combining that with the cognitive testing gives us even a little more precision about that. And I think that's where we'll be moving towards. It's a great question. Anything else? Okay, we need to save part 2 for...
Yes.
All right, we'll do. Thanks very much.